So welcome to the HealthspanMD Podcast, where we talk about the science of longevity. And today we have a special guest, Dr. Mona Amini. She is a concierge psychiatrist, an incredible presence here in Phoenix. In fact, I was just telling her I was having lunch with a business associate, and I'd mentioned I was doing this podcast with Dr. Amini, and she says, "Oh, concierge psychiatry. I don't know, what does that mean?" So I pulled your website up and I showed it to her, and she's like, "Oh my gosh, this is a beautiful website." And then she came to a picture of you and she goes, "Oh my gosh, is that her?" And I was like, "Yes, exactly." And so she was very intrigued right off the bat. But I'm really excited to talk to you because of the importance of mental health in longevity, something that I believe you'll see, as I do, being traditionally trained physicians, is that mental health has really taken a back seat in healthcare, and that needs to change, and I think it is changing, and I think your practice is a great example of how that's evolving. So, welcome to the HealthspanMD Podcast.
Thank you for having me. It's a pleasure to be here today.
It's such an honor for me to have you here. So I love your practice. I mean, the first time I was introduced to it was before I knew who you were. I looked and I'm like, oh my gosh, somebody should have been doing this years ago. How did you evolve from, doing a traditional training and really a diverse background that you have to developing this practice that you have now?
In my med school and residency career, I always saw myself as being a little bit more out of the box, in terms of how I wanted to practice and how I wanted to treat my mental health patients. And I thought that I could be able to do that in some sort of creative, clinical, or administrative role in more of the corporate positions that I was having and, being a part of. And then over time, I noticed that wasn't going to exist. And it was going to be myself trailblazing something very different, not only for myself, but for others. And really what exists out there is very limited in terms of the success rates for just traditional psychiatry and the benefits for the patients overall. And what I noticed on a clinical level over a decade of practice was it was not just the toolboxes that we were given in residency and in our training. It was a lot of other additional manners that we have to keep building on and training our patients. And some of those tools it's not just medications, if it even is psychotropic meds, but it's also therapy. It's experiential therapies, which are more of like the to-do therapies, things that you're actively involved in, or tangible. So like equine therapy, exercise, music, lifestyle changes, dietary adjustments, supplementation. All of these are factors of true mental wellness. And over time, after I started seeing so many patients just kind of regress and not really do very well, they would do well in one season of their life with meds, but then when something would cause a change, or they would move or change some sort of career or relationship, those dynamics were big stressors. They were impacting them and they didn't know how to respond. And so if they didn't have the tools to set boundaries, build healthy relationships, understand that lifestyle is going to change based on your history, based on your age, and who you're surrounding yourself with, on top of all of these other factors, we're not doing ourselves a service as medical doctors. And so that's what just was the impetus of bringing on this practice for myself and to help a community of patients.
That story resonates with me so much because, I've spent my career in a traditional insurance supported practice, corporate medicine, whether at Mayo Clinic or Banner. And that, the model that exists there does not allow us the time to understand the patient, build those relationships. And, one of the things that you and I have been a part of is the Top Docs organization here, and Amber Enright, Dr. Amber Enright, runs that. And one of the things she does is everybody gets up in the meeting and gives like a little spiel of their practice, and then she says, and then a tagline. And I've never had a tagline, I felt inadequate in that. But as I've been thinking through this, I've realized I do have a tagline, while longevity is a recent kind of refocusing of the practice that I have, that can mean a lot of things to different people. But what I've realized, to me, what it means is exceptional healthcare that gets results. And what you just described is exactly what I've learned in my medical practice, is that for me to get results for my patients, I need to know who they are. I need to know their goals. And it's changing all the time. Like, they're dynamic, their health is dynamic, the world's dynamic, the insights, the knowledge is dynamic. I can't do that in a 15-minute office visit. And so that's where, the most psychiatrists, in my experience, it's been, about a 15, 20-minute visit, which ends in a prescription or a change in medications. It sounds like you realize, okay, I'm just not helping people the way I want to, and that's why you created the practice.
I really felt that it is not anything that is helpful in any way. And in fact, I feel like it's more of a disservice, because we have to realize that we are the leaders of the medical community, and people are coming to see us based on our expertise and our knowledge base in whatever field or specialty that we're in. And with that being said, the layperson coming into our office and sitting in front of us does not have the expertise or that knowledge base. And so if we have the capability to educate them in a very, reasonable manner, in putting it in their words, putting it in their terms, here are things not to do. Here are the aspects of care that will be really, really important for you to kind of implement and change about your lifestyle or about your diet, what you're looking for and what you're looking to achieve. I think that's way more important than giving them a prescription and a refill. And what I had seen time and time again was these patients were on meds, the same medications, mind you, for over 20 plus years. Never really adjusted, just kept, refilling. And it wasn't necessarily always a psychiatrist or a mental health provider. It could have been a family practitioner or PCP, but still I don't think that was really helpful. And the patients would even tell me, I didn't think it was very helpful. I don't know if it's really doing anything for my depression, but I was always really scared to have that conversation with my doctor about a change, about a dosage change, or even taking it off. Because all of these are wrapped into the lack of education and spending time with my patients. My patients that I see, it's no less than 30 minutes, our follow-up visits. So even then, we're doing a little bit of toolkit, prescribing that I call it. So if I'm customizing their plan on a therapeutic level, we're working on those things. We're doing check-ins in between our, in-person or virtual visits as well. Because again, like you said, life changes, society changes, and it could be like that. Yeah. So I want to be there for them for that reason.
This is how we deliver great care. Like it's necessary, and those changes are not slowing down. No, they're exponentially growing up. I mean, your husband gave an excellent talk about the coming AI and things, and I just sat there like and just saw this tsunami of information, tools, and you're right. Like we as physicians have to be the advocate for our patients to do that. And we can't do that in a system where we're, mandated to see 20, 30, patients a day.
Yeah.
Yeah. More.
Oh, yeah.
I often, am in those conversations with people. I'm not in that corporate medicine. I spend, like you, I have a lot of time with my patients, and I'm really grateful for that. But when I hear the doctors being blamed for the system, I'm like, you don't know. They're not happy either.
No,
you know?
no. And actually that was a big part of the reason why I pulled out of that, because I was time and time again just feeling really just, it wasn't resonating with me.
Yeah.
And, you know, I went into psychiatry with a true passion, true love of mental health and psychiatry in that field. And year after year, I'm like, this is not what I signed up for.
Yeah.
I wanted to help patients. I wanted to help them in every aspect possible. And for that reason, once I started my practice, I started kind of leaning into the social media and, you know, speaking world, because I want people to know that the stigma is still there. And even to this day, just a couple days ago, the stigma is still there, to the point where people think that if they have to come to see me or they're referred over to me, that they're crazy. They're labeled as that. And it's still an ongoing, uphill battle. But I took the intention of, well, I want to be a bit more vocal out in the community, out in the social world, to see not only, you know, I'm a caring psychiatrist, I am female, I'm a business owner, I've been in the corporate and, you know, executive space. I have this passion and love, and let me show you how dance and music and fashion and some of these other, you know, off the wall kind of tools to other, you know, individuals can actually help you in life. Because we're not all traditional, judgmental, you know, types of mental health providers. And I think that stigma is still very much prominent, but I want to reduce that. Like, look at that, you know, I want the Gen Alphas and the Gen Zs to realize that it's going to be okay for you to see mental health providers.
Yeah, you know, I did not know that was your intention of your social media, but it makes so much sense. And how effective you have been at that. Like, I will say, in retrospect, when I, you know, looking at your website, in your social media and the things you've put out there, that's the exact message I got. Like, you know, just that you take that stigma away to say, look, if somebody who's, you know, got so much accomplishments, you know, so it has this sense of style, that's cool, right?
Yeah.
It is also a psychiatrist, that takes that away. And, you know, it really is a big problem, because I don't know if maybe this will resonate with you. Most people don't know. Cardiologists see a lot of mental health issues, you know, particularly anxiety, panic attacks, because what are the symptoms of a panic attack? You know, chest pain, shortness of breath, sweating, all sounds like a heart thing, right? Heart racing. So, I've diagnosed those, you know, regularly in the day. But it was always like, I had this hesitancy to say, you know, and I'd go long ways around so I wasn't implying, oh, it's all in your head.
Yeah.
You know, because that's how some people took it. Oh, because we do all the testing, of course, and their echo would be fine, and their Holter, all these things, and it was normal. And then they oftentimes would be dismissive. Oh, well, it must be all in my head. And I'm like, no, this is a real thing. This is, and so kudos to you for taking that away.
I mean, I think it's so important for them to understand that even if it was all in their head, and it's a mindset shift that they just need to lean into and understand. And now they have the opportunity to shift that away from being panicked and somatic, so less bodily influenced and more of, let me look at this as like a cloud that's going through and just passing, and let that anxiety shift away. Let me just watch it leave and let it pass, instead of, I'm just building up, it's all in my chest, I'm sweating and all of these things. And we have these tools. We educate as much as possible, but when you're going through it actively, the patients don't know the difference. They feel like they're dying.
Yep.
They feel like this is something that is an impending doom, and they need to go to the ER and, you know, get all of these cardiology
right.
tests and imaging and interventions potentially But yeah, we see it a lot.
When you see a new patient who's coming with some hesitation, they're like, maybe, oh, I don't even know if I need to see you, or I'm embarrassed that I'm here. How's your approach to them to, get them to understand they're in the right spot?
I try to tell people that it is, number one, it's okay that they actively made the first intention and steps to get themselves through the door and sit in front of me in my office. That's a huge step in and of itself, because on average, I will say the lead time to see any mental health provider, probably the most length of time is going to be with a psychiatrist, but it's months. It's months. You are not going to make that decision as like you're going into a med spa or another type of medical office where you decide that I want to get my Botox and I want it tomorrow or next week. Mental health is a very different lead time. And patients sometimes on average take about 6 months or more to really dial in and say, okay, I do have a problem that I need to get help for, but now I have 4 to 7 different options of mental health providers. So now who do I choose? Who do I go to? Otherwise, it's way too inundated with so many different options, and then they don't know who to go to. That choice, what I try to tell them is I'm kind of like an all-encompassing. So because I do a lot of the therapy, because I'm doing the medication management side, and then we're working on almost an integrative level dependent on the patient. If we need to dial in on supplementation, are your vitamin levels, hormone levels okay? We're adjusting those, or we're addressing those accordingly. And some of the other, more coaching lifestyle practices are what I'm addressing with them. So if they are still hesitant, I kind of show them almost like a map. Here's your timeline. And all of the childhood, adolescent, teenage experiences, young adulthood, and dependent on where they're at, in their life right now, but all encompassing. And then where's your future? Where do you want to be? And this is where you and I align really, is in the future, do you want to be stagnant? Do you want to just be passively learning? Or do you want to still be able to hang out with your grandchildren and take them on hikes and, build better relationships with the networks and all of these opportunities out there? Or, do you not want to make a change or shift? And by the way, I'm very discreet, confidential. You're in an office where it's just me. We can see each other virtually. I try to make it as foolproof and easy for them to make that decision as possible. Because I feel that out there's, again, so many options that they're feeling like it's too much. And I want to lessen the risk of them making a different type of decision. And a lot of times that decision is, I don't want to see a mental health provider at all, because I just feel like I am going to be labeled in this manner. And again, that stigma is just it's so apparent still.
Well, in fairness, one of the areas that has the most stigma to mental health is medicine.
Oh,
right?
yeah.
I mean,
100%.
I'm sure you have, experience where as a MD, there's certain things you can't tell another MD, or that MD is required to report them to the board. Like this is, it's a thing that really needs change. I love what you talked about, because I wanted to explore that with you, is that's been my experience, both as a business owner and also from a personal standpoint, is when you have a lot of choices, oftentimes you just say, okay, none, right?
Yeah.
There's too many here.
Right.
I can't make this choice. And there in mental health, there's one, so many choices. Number two, so many different approaches. And somebody's out there now saying, okay, look, I realize I'm having issues with, let's just say anxiety or depression that, is affecting my quality of life. What advice would you give them to get started on getting professional help that is credible and that they can trust?
I would say, number one, if they feel like they have a supportive network around them, to inquire with their friend or family group or even their doctor that they trust and go from there. Because the referral base of that, if you know that your girlfriend, for example, has an amazing therapist that they really resonate with, very comfortable with, then it's likely that you will have the same, benefit from them, and maybe you'll resonate with them as well. But it's really hard to find somebody out of the blue on your own. Google reviews will tell you a little bit, but not until you step in and have that first intake and first visit with that individual, whether it's a therapist, PsyD, PhD, MD, you won't really understand the capability of you feeling comfortable with them, being open and honest and feeling like they're trustworthy, and then, vice versa. So what I tell people all the time is there's a trial and error. And it's not just with psychiatric medications. There's a trial and error of finding a right provider for you. Because if my patient really resonates very well with an older gentleman, then I am going to refer him to an older gentleman for a therapy, visit, whether that's EMDR, trauma, whatnot. I'm not going to point him in the direction of a young female therapist because he won't feel comfortable. Then he won't be open and honest with them. So if you kind of know your avatar of who you would be comfortable seeing, start from there, work it around your network, the trusted people, and then look into who you can follow. My intention is not to feed into my practice. My intention is to really show you that we are human too. And even though we have businesses and we're practicing and I'm teaching about mental health, I, have a loving husband and children at home. I have a human, life as well. So understand the tools that we provide to you are often tools that we utilize ourselves, and find a provider that, you feel like you can utilize their tools to your advantage if they're providing that to you as well. You really need to vibe with your doctor or your therapist at the end of the day.
It's such a big threshold to overcome because I have to admit that I'm, it's all in my head, or I'm crazy, whatever, mindset that you go into that. Then you have to, a shot in the dark, hope you connect, and you have to share very personal things right off the bat. And you can understand why people find, just check, D, none of the above, oftentimes to their detriment. And I really love how you frame I don't know what the right path is going to be for that person, because that's exactly my experience in cardiology. I see people with blood pressure, for example, that's been very challenging. They've seen lots of doctors, they've tried lots of medications, and they come to me and I tell them, I don't know what your path will be, but I promise you will get there. In my 20 plus years of experience, there's nobody I can't get their blood pressure down. I just don't know which way it's going to be yet.
We don't. And we're just helping them navigate that. We're helping to mentor or mediate that path for them. That's all.
Yeah. It's how you, in my mind, recognize a clinician versus a marketer. The marketer will say, oh, this works in everybody. The clinician has been humbled enough to say, okay, I don't know this is going to work. There's no guarantees, but from my experience, this seems like a low risk, high reward thing. Let's try it out, and we're going to learn from you. And if it doesn't we're going to learn from it and we're going to find something else.
Absolutely. I always tell my patients I can line up 5 different individuals of all different ethnicities or genders in front of me, and every single one, same dosage, same type of, brand name medication, and everyone is going to have a different response or side effects. And so with mental health, we're not attacking bacteria. It's not one unified, medicinal property that we're going after and targeting. It is very different, because in mental health, we're taking all of the biopsychosocial components of your life, and we're trying to target and treat those for whatever symptoms we're trying to target and treat, or the types of behaviors we're trying to target and treat. And that will differ from every single individual, which was a big part of why I just created this more customized plan. Everybody that's coming through my doors, none of them are on the same gold standard treatment, because there is, to me, really no gold standard treatment in mental health and psychiatry. We just don't have that. We're not blessed with that as of yet. And so, you're going to have individuals that, because based on their pharmacogenomic testing, maybe they're fast metabolizers of something, so I need to adjust the medication accordingly, versus if I had another individual, same properties, everything, normal metabolizer, we're going to have different, targeted solutions for them.
Yeah, it reminds me when I was at Mayo, one of my favorite mentors, one of the been around forever, knew everything, like brilliant guy. And whenever somebody in conference would say, oh, well, that's in the guidelines, and he'd always say, well, that's the C+ doctors follow the guidelines. Yes. That's the algorithm approach to it. It's the great doctors that know when they know the guidelines, but they know when the guidelines don't apply in this situation, and that's what you just described. I wanted to get your thoughts on SSRIs, SNRIs. I think there's probably some similarities in your world in those medications and my world in statins. So, statins are really commonly prescribed. There's a lot of false beliefs about them out there. But from a non-expert standpoint in SSRIs, SNRIs, I hear a lot of mixed messages about them. One, they're overprescribed. Another, they're underprescribed. That, coming off of them is challenging, not challenging, all of those things. Could you just give us a little bit of your insight? I mean, the number, the millions of people are on these medications.
And I think a lot of that, again, has to do with the marketing trends that we saw decades ago. And a lot of those SSRIs back then were marketed more towards family doctors, because the majority, and I know this, the majority of our mental health patients and psychiatric patients, they were seen, or they're still being seen by a family doctor. Yes. They're PCPs. Yeah. Again, that stigma is there. They don't want to be connected to seeing a psychiatrist. They'll be labeled as, whatever they feel resonates with that label. So we see a lot of that for that very reason. Very similar to the number of benzodiazepines like Xanax, for example, that were way overprescribed. So I think that just in practice alone, again, if we customize our solutions way better and we're not just following the standards of the other C++, or C+ doctors out there, I think we have way better tools than just SSRIs or SNRIs alone. And I have gotten patients successfully off or on the absolute minimum dosage of SSRIs or their antidepressants that they had been on for decades, just by, again, the therapy, lifestyle changes, some of the other tools that we've been, working on with them. And ultimately, how much are they really feeling like they're effective? I don't know, because there's no measurable tool of that in a way. Right. We have our questionnaires and our screening tools and such, but again, that's so subjective, and it could be on any given day if they're doing really poorly that day for whatever reason versus they're doing really well that day because their boyfriend finally called them back, so where are we to judge how well those are? But I think we can always direct our medications in our classes and how much they're being prescribed as over or under. But when you look at it on more of a grand scale, out of the psychiatrists prescribing those, how much are they over or under prescribed? How much of that is really being utilized because the patients themselves are deflecting any change whatsoever, and they're refusing or they're declining other types of tools or augmentation or lifestyle strategies out there. Unfortunately, what I found in the US is instant gratification is pivotal to most people's lives, and they're looking for that. We see that trend with the GLPs right now and et cetera, but we see that a lot of the same effect with the community that are on the antidepressants.
Yeah, well, the benzodiazepines has been a big topic in the media lately of, overprescribed and coming off of those. And you're right, like they are somebody with an anxiety disorder, it's a temporary solution, but then it gives them a second problem oftentimes, that is challenging. When I got introduced to you, somebody had said, oh, you should look at her practice because they felt like we were, aligned in our kind of, comprehensive approach. And I loved how you incorporated lifestyle things into your practice. And I've realized in my own practice, somebody, could be telling me about their anxiety. And I'm thinking, I don't think it's an anxiety thing. I think it's an under-exercise thing, like for me personally, I know how valuable being active is. I'm active every day, not because I have this iron willpower. I do it because mentally I need that.
Right.
Like I feel good doing that. But I also realized when I was in training, I knew nothing about nutrition, physical activity, sleep, stress. These things were not things we talked about at all. How did you come to this, the understanding of how valuable those other aspects were?
I've always been interested in it. Even during residency, career, and training, I was always kind of looking into the more integrative strategies at that time, supplements, vitamins, herbals, how they could, fit into the picture of traditional psychiatric practice. And then over time, I just educated myself. I kept on, learning more and more and utilizing books and podcasts and just reading as much as I could, continuing medical education, and found that there is no one, stop solution for any one of our patients in mental health. There really isn't, because everybody has their own personal lives that they've, come to fruition to the point of when you're seeing them. And a lot of that, we all have some sort of trauma that we've endured in our life. Sure. And that could be big trauma, big T trauma, little T trauma, and a little, impetus to that. But what the strategies are going to differ per each patient that is seeing us. And ultimately, my practice is based on all of that, all of those aspects, and really devising some sort of plan for you in that plan of action. But I want you to be invested in that. And that's a big tool. And I think that training you and having those conversations with you and shifting the mindset of it's not just about meds. It's not just even about talk therapy. It's about those matters of your hygiene and sleep and activity, what you're eating, what you're putting in your body, the brain-gut axis, and all of that. These are in constant communication. So if I'm giving you an SSRI or if I'm giving you medications and prescribing that, yet you're eating McDonald's a couple times a day or more, this isn't going to, reflect well on what, benefit you're going to come out of that.
Yeah, so powerful. And you're exactly right. Like you're we're often in medicine prescribing a Band-Aid and not addressing the root cause. And that's, kind of where you went. I'm curious, and I'm looking for some advice, frankly, that you can give me. I was trained traditional medicine, the Mayo Clinic, the whole thing, and like supplements. I was taught by my mentors, oh, well, that's just expensive urine, right? Like that, it's waste of time. And I always, I went along with that. I mean, my mentors told me that. And then I did a very simple vitamin D, my vitamin D was kind of low-ish, and doctor recommended that I take vitamin D, and I was dismissive. I was like, oh, the research studies, the placebo-controlled randomized trials, all this stuff. Well, then, I don't know, for whatever reason, I started taking it. I'm like, oh my gosh, I feel better. It was a really powerful experience for me. And now I'm discovering other things. And I certainly, I know patients who have had, prominent benefits from supplements, but it's also a slippery slope as well. Like, how do you think about navigating those things when we don't have 14 New England Journal of Medicine, placebo-controlled randomized trials to show its benefit, yet when does that tipping point come where you're saying, okay, I'm going to recommend this to this patient?
A lot of times I know that the patients are really more like-minded in the fact of I've been doing everything else. I'm doing clean eating, but something is missing. And it could be they're just low in magnesium levels, low vitamin D. We see that a lot. We have a beautiful, city with, the ocean above us and blue skies commonly, but we still see a lot of low vitamin D, B12, all of these exist in the deficiencies. And if we're not addressing that, we're doing a disservice to our patients and expecting them to have really great outcomes and really great energy and all of the other things, when if we had originally just supplemented their vitamin D and other levels that they're deficient in, why wouldn't we do that? Yeah. And again, a lot of these intertwine with mental health. So we see a lot more depression, low, chronic fatigue, pain, anything that's coming out of these deficiencies, or in like fluxes and thyroid and all of those different options of treatment as well. And you can do the brand, names. You could do more of the integrative strategies, but encompassing on that, if I have somebody that I'm putting a B complex addition or the omegas, they're going to have more cognitive, functioning. The brain fog is going to decrease. And then I'm allowing them to have the opportunity to be more active in nature, sleep better. All of those are better opportunities. But I agree. I think that just the supplement field and vitamins in general, they have a bad rep because a lot of these are not FDA approved. That's a whole different subject matter that I won't get into, but you have some tried and true companies that are really doing due diligence on how they're manufacturing and, labeling their options of treatment. But they're also great augmentations to maybe the SSRI that isn't working, that needs a little bit of a boost. So we'll add a little bit of L-methylfolate to that, and it's amazing how things will benefit from there.
One of my favorite sayings of all time was for every, I can't remember who said this, but for every complex problem, there's a simple solution, and it's wrong. And what you describe sounds hard. And you emphasize the partnership that you have. I mean, it takes effort, right, from both sides. But what I've pointed out to my patients at the time is like, it's going to be hard either way. It's hard being anxious all the time and not leaving the house, and it's going to be hard dealing with that as well. But which hard do you want? Because It's hard either way.
I love that you said that, because it's a tool that I try to use with them as well. I'm, astrology wise, I'm a Libra, so I'm always looking at the scales, right? So I'm presenting them with two options. Out of the options, choose one. you either continue with your agoraphobia and feel isolated and, stay in your bubble at home, and that makes you feel safe. The other option is also hard, in which you're actively going to have to go through treatment and understand the tools that are needed for you to get out of your, social anxiety bubble. And maybe that's with medication, at least for a certain amount of time, as we're doing more therapy and actively going through different types of treatment plan, changes, and addressing the core of the problem, which could be a number of things, by the way. And I love that about my field, in that, again, no one person is coming to you with the exact same thing that the other came in with, the day prior. All of us have had different dynamics of family growing up, our upbringing, our ethnicities, our cultures, all of these things, and all of the opportunities that we've had that exist to this day. Are they going to be beneficial to us, or do you want to kind of do a clean slate and let's take this as an opportunity to kind of wipe what's happened and start anew, and here's how I can help you get to that, so that the rest of your life, you're forming better friendships and relationships, you're choosing better partners, and you're making better decisions ultimately to have you live longer,
yes,
right?
Yeah, there you go.
Yeah.
I want to ask this, I'm struggling to think of how to frame this, but I see people with some kind of wake up call about heart disease risk. Let's get a CT calcium score. Somebody believes they're healthy, they get a calcium score that's really high, and they're like, oh, it's done. Like, go buy health or life insurance. Like, I fill out my will, and then I see them and I'm like, we can take this off the table for you. It completely changes their hope. Like they come in like, well, there's nothing that can be done about it. And I'm like, no, we can essentially guarantee, that we can stop this. Do you feel like that same thing in mental health, that people are like, yeah, you're not going to be able to help me anyway, so what's the point? And then they see you and get hope?
I have had everything in between. So I've had patients come to me that have never seen a psychiatrist, and they just resonated with me. They had been following me for quite some time on social media, and so they felt like they would be comfortable seeing me. And then I've had patients that have seen other psychiatrists or mental health providers for decades. And taking all of that into consideration, and then there's your gray area, I'm the second or third that they've seen. Out of those two, what I've heard was really amazing to me, in that they've never had anybody that has really taken the time to understand them, to actually understand that, and provide them these tools that they didn't even know really existed, because it's overload. We are just overloaded now with so much information. Yeah. So how am I supposed to just deliver that, or expect a patient to understand what is going to work for them? So we work on these strategies and we build something together. And they need to be invested in this. Otherwise, it's not just their time, but it's their mental effort. When I'm asking somebody to journal or to meditate, I'm not just telling them just because. I don't want to make you do something that you're not going to want to do. It is actually for good reason. I'm trying to train. I'm trying to help you with some neuroplasticity. We're doing different items of action that will be of benefit to you. So it takes some time, but you have to give them patience to make that decision too. Because there's a little bit of a difference in our populations in a way, because when they're seeing you, they know that this is about one organ, and they, historically as a cardiologist, that's everything and only that. In psychiatry and mental health, this is controlling everything else, including their life around them, and the dynamics and, the nature of how they present themselves out to the outer world too.
It's so interesting that you say that, because in younger years, I was very math oriented. I like specific answers. And when I got to medicine and realized there's no specific answers,
creativity.
I think that's why it drew me to cardiology, is because there's a little bit of specific answer. You know, the EF's 55, the stenosis 70%. There's a little bit more certainty there, although still with a lot of challenges. What's the best patient that you see? Like who's the patient that's going to come to you and you're going to be like, boom, that's it. That's the person I love to see.
So I am unique in that I actually love variability. So I get the question all the time, who's like your best avatar of a patient? And I tell people, I mean, I see all adults of all ages, of all aspects and walks of life and all professions. So you can give me, an elite ex-athlete versus a retired big executive versus somebody who, is out of the environment of their career and they're just working on themselves, and this is their new aspect of life. This is their new journey, is that they are just a woman who is overseeing like the care of their kids and being a really great partner to her husband, but also feels incredibly anxious and wants to work on these things so that she can be a better person for her partner and her family. So I can't answer that. I really enjoy.
No,
I really
love
enjoy.
Yeah.
Yeah. I see, substance abuse. I see depression, anxiety, bipolar disorder, schizophrenia. You name it. You name it. We're working on all of it. Because again, I tell you, when somebody has been diagnosed with a major depressive disorder, they feel like it's a lifetime diagnosis, and they will never get out of that. But it could have been a single episode, and if we worked on it from the beginning and I showed you some tools to work on that effectively, you can prevent future episodes, or you can prevent the episodes from being as severe and so impactful to you. And that's not with meds. It's a lot of up here and that shift in mindset.
Your practice just seems so artistic to me.
It is. It really is.
You have all these tools, and you just get to be the alchemist, right?
Yes.
To say, okay, I think we're going to do a little of this and a little of that, and that's really cool. So for all those people who are going to listen to this and say, okay, I'm seeing Dr. Amini, what would they expect? Like, what's that initial visit with you like?
So they initially have what's called a discovery call with myself or my assistant, and from there we gauge, am I somebody that you would want to see, and vice versa. Not everybody is appropriate for concierge practice. Sometimes, especially for somebody that needs more of a team, social worker, a therapist, or a nutritionist, because they have a really severe eating disorder, I'm likely not going to be a great psychiatrist for you, and here's referrals out. Then they would see me in the office. We would schedule a 90-minute to 2-hour visit, and that's my initial evaluation. And we get a lot of the history and formulation of a treatment plan together. And so I kind of have that conversation with them based on what they're presenting with and some of the questionnaire item answers. And then from there, we develop, the frequency of seeing me, whether that's weekly, monthly, bi-monthly, however that sees. And I see them in the office. I can do virtual as well. And in my office, we can do meditation. We do some mindfulness. I train them and I educate them on how to do that so that they could effectively do that at home.
Beautiful. Wow, it's been such an honor having you here. So for all those people that want to connect with you, what's the best way to find you?
They can go on my website. It's MonaAminiMD.com. They can also call the office or text the office at my office number. And then I'm on socials, especially Instagram and LinkedIn, and they can follow me on there.
Great. Thank you, Dr. Amini.
Thank you. Thank you for having me.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.